How are you? Very nice to see you again.
One second. Got There's multiple speakers, so we just put the mic there.
Sounds good.
Okay. Yes.
Oh, no, I'm not.
Yeah, just to see. Hi, good morning. Thank you for joining us today. There's some microphones around here. Let me make sure that I don't mess them up. 1 month ago, at an in-person pandemic task force meeting, I said we could see the end of this pandemic on the horizon if we did two things: work together to protect one another and get vaccinated. That hasn't changed. We still see the end of this crisis, but we have to rededicate ourselves to both of these principles. More and more people are making the decision to get vaccinated to protect themselves and their loved ones from COVID-19. That's great news. I did my research, got the facts, talked to my doctor, and made sure my entire family is vaccinated, including my 13-year-old son. But while more people are getting vaccinated, we are still at a dangerous point. Last week, facing case infection numbers not seen since our deadly spike in the winter, the St. Louis Pandemic Task Force urged residents to mask up and stop the spread of COVID-19. You can still spread COVID-19 even if you are vaccinated. You can still get sick. 1/2 of all COVID-19 cases in the United States are occurring in these 3 states: Texas, Florida, and right here in Missouri. The Delta variant, the most infectious and dangerous strain of COVID-19, took hold in Springfield, Missouri, before spreading like wildfire around our state and now is on our doorstep. The reality of this virus has changed from a year ago. At the urging of local health experts with the St. Louis Pandemic Task Force, County Executive Dr. Sam Page and I took action by instating a mask mandate to stop the spread of COVID-19. As of yesterday, the CDC is considering doing the same. Masking and vaccination go hand in hand. Getting vaccinated is critically important. While you can still catch COVID-19 if you're vaccinated, your risk of ending up seriously sick or in the ICU is greatly reduced. That frees up our hospitals to take care of people who need help, whether they are sick with COVID-19 or not. We don't want our grandparents, our loved ones turned away from a hospital bed if they need one. Wear a mask to protect those around you and to stop the spread. Both of these together are solutions to protect each other, to keep each other safe, and help our hospitals and medical professionals provide the care our communities need. But already, we see right-wing politicians try to tell us what's best for St. Louis, teeing off against our city to score political points. Our Attorney General, who is running for Senate and has a history of filing failed lawsuits, wants to file another frivolous lawsuit to serve his own interests and at the expense of public health. It's easy to grandstand with your biggest concern is filming your next campaign commercial and chasing clout. Dr. Page and I are taking action now so this crisis does not escalate or spiral even further. Vaccination remains a top priority for my administration. Besides holding events at pop-up clinics and community centers, our Department of Health is looking at connecting with people at the places they visit on a regular basis, like barbershops and beauty salons. We're seeing the highest uptick in vaccinations are in the Black community. These same neighborhoods account for about 3/4 or 75% of all new cases. My administration is examining every possible avenue to encourage vaccination and to meet the hesitant where they are in their own communities. Since June, I have been stressing the urgency of using federal dollars to get shots in arms. And even though those funds have been tied up in political games, people can't wait. And I'll end on this note. We see the largest amount of hospitalizations in young adults between the ages of 20 to 29. Many of our youth don't recognize the risk this virus poses, not just to them, but to their families as well. I lost my only remaining uncle to COVID-19 in November. He passed away in a local nursing home. Even if you aren't concerned for yourself, think about the people in your life and in our region who need to be protected from this virus. Vaccines help keep us safe, healthy, and out of the ICU. Masks help stop the spread of disease. We came together once to protect each other, and I am confident that we can do so again. Thank you, and now I'd like to bring up Dr. Sam Page.
Good morning. These masks save lives. They prevented thousands of people from getting sick and dying. And when the mayor and I stood here in May and announced that our health departments would be relaxing some of the public health orders and protocols, including wearing masks, we did so because the case rate was headed in the right direction and vaccine access was improving. Both trends, again, in the right direction. But the Delta variant has thrown us a curveball. It's highly transmissible, and it's now jeopardizing our progress. On June 1st, the number of COVID-positive cases in St. Louis County was 40 a day. 2 months later, on Saturday, the number of cases was at 218 a day. On June 1st, the positivity rate was 2.9% in St. Louis County, and 2 months later, on Saturday, it's 9.9%. These numbers are too alarming to ignore. We, as healthcare professionals and as elected officials, can't stand idly by while this new Delta variant takes more and more victims. Masks have become a symbol of a political divide in our country. But they're not a bridge too far, as some might say. Rather, they put the virus in the slow lane and give us time to get more people vaccinated. In St. Louis County, we've launched Revive STL, an education campaign featuring people who have been vaccinated, talking about the vaccine, their experience, and urging others to get vaccinated as well. While we're diligently working to get vaccination rates higher, masks still allow us to get more and more people vaccinated and get our kids back in the classroom. Masks will allow businesses to remain open. Masks will allow our economy to continue growing and will keep people employed. Masks will allow us to keep doing what we're doing while we get more people vaccinated. And vaccination remains our focus. My priority is using all of our resources on education on and access to vaccinations. And the virus continues to disproportionately affect the African American community. Repeated opposition to medical experts who've been on the front lines of this pandemic for the past 18 months is adding oppression to the oppressed. Solutions must be for everyone, not just a select few. For real equity in our community, we have to have some inconveniences for some people. To have a safe and healthy region for everyone, it must include equity for all. Creating distractions for political gain is short-sighted at best and life-threatening at worst. As some passionate supporters of the previous president hold on tight to bombast and misinformation, we are laser-focused on protecting the health and welfare of people in our communities. Masks provide the freedom to move about in our community while vaccinations continue and our efforts continue to get as many people vaccinated as possible in our community and across the country. For those who are vaccinated, this may feel like punishment. Punishment for doing the right thing. I've heard that, and I feel that frustration. While the vaccine can protect against serious illness, it can't protect you from being infected with COVID-19 and passing it on to someone else, someone who may be more vulnerable. Until more people get vaccinated, we must continue to do what we can to protect ourselves and others. I wish we had more people vaccinated, but right now, this is where we are. Last week, the U.S. Surgeon General said that he would support those local communities like ours, initiating mask mandates, masking protocols, masking requirements in areas where COVID is surging, like Missouri. And yesterday, the American Academy of Pediatrics, only a few days ago, made a statement that they supported masking for kids over 2 in schools and teachers and staff, regardless of vaccination status. And the St. Louis Metropolitan Pandemic Task Force has recommended masking when you're in crowded public places, especially if you don't know the vaccination status of those in the room with you. As an anesthesiologist, I work an occasional shift in a hospital. I've had the chance to talk to people who've been on the front lines over the past 18 months. Those who have been sitting with patients in the ICU when they ask to be vaccinated, patients who are struggling to breathe and being placed on the ventilator, then is not the time to get a vaccine. Don't think that this won't happen to you. There are plenty of people who can tell you differently. We are among the first counties in the country to reinstate a mask mandate. So help us be one of the first counties in the country to eliminate this pandemic. If you haven't been vaccinated, please get your shot today. I'd be glad to answer any questions, and Dr. Dunnigan is here as well from the Pandemic Task Force to answer questions. Yes? Okay, so the question is about targets for lifting the mask mandate and enforcement. So I'll take the targets first, and then I'll let Mayor Jones respond. We will certainly continue to make all of our decisions regarding public health protocols based on expert advice from our public health experts in our public health department and the Pandemic Task Force and national experts. We'd like to see the case rate going in the right direction. In the past, we had targeted 100 cases a day in St. Louis County as a time when we would consider changing restrictions, and that would be a reasonable goal. We would continue to also consider, is this going in the right direction or the wrong direction, how full are our hospitals, and is there a new variant that's limiting the impact of the vaccine. But all of our decisions will be made regarding public health protocols based on expert advice from public health professionals nationally and locally here in St. Louis. As far as enforcement, we'll do this like we did before. We'll look at this on a case-by-case basis. We certainly are focusing all of our energy on getting people vaccinated, and we are fully aware of all the challenges around enforcement. What we've seen in the past in our community, when we tell folks this is the right thing to do, the vast majority of folks will do it. And the folks that don't do it are going to be outliers, and that'll certainly include folks that don't want to protect themselves or others for political gain. Would you like to add anything to that? Yeah, there are two pockets of folks. There's vaccine hesitancy, and we're working through that through education programs, peer-to-peer, a very intense effort in St. Louis County and St. Louis City, including door-to-door campaigns and communication and activity through social, print, radio, and TV ads, and we'll continue that intensity. There's another group, vaccine hostility, and we hope that we can turn that down. Unfortunately, that's fueled by the political environment, and that's just an unfortunate time in our history. Add anything to
Yeah, just adding to what Dr. Page said, we are using our every resource available to try to educate people to get vaccinated, and we are finding that the best way to do that is to meet people where they are. That's why we have initiatives going in barbershops, beauty salons, churches. We're showing up at just about every community event we can. There was one just last Friday with State Representative Kimberly Ann Collins at Farragut Elementary School, and we had a vaccination truck there, or our mobile vaccine site, and we saw people actively getting vaccinated. So we have to meet people where they are and in their communities. There is an uptick, but again, just not exactly where we need to be, and especially in the African American community, only 23% of African Americans are vaccinated, and yet we're over 75% of new cases. Yes. Well, that's assuming that he's successful, and he won't be. I mean, he even sued China over the over COVID-19, and he wasn't successful in that. I wish that he would put more of his attention towards serving the people of the state of Missouri instead of and also holding our health and safety paramount instead of filing frivolous lawsuits that waste taxpayer dollars. I'm sorry, what? Well, we'll cross that bridge when we come to it. If by chance that we have to take this before the Board of Aldermen in 30 days, we're willing to do so. I haven't heard from any of the aldermen yet about the mask mandate. Any update on Board Bill 2? We are continuing to reach out to President Reed to try to come to a compromise. Again, the language that he has in Board Bill 2 does not pass muster, does not follow U.S. Treasury guidelines. And we continue to reach out to find a way forward on Board Bill 2 because we want to make sure that we get shots in arms and resources to the people that need it most. I'm sorry, what? We are still evaluating that with the comptroller's office. Yes. I'm sorry, he is. How will they affect the reopening of schools? I don't think this affects reopening of schools or any business that's currently opening or is currently open. We just are reinstituting a mask mandate in public spaces.
I think we'd probably add something to that.
Go ahead.
I think it's important to recognize that this mask mandate is what helps us get our kids back in the classroom and keeps us on a trajectory towards in-person learning, which is very important. We have a lot of pediatricians in the community that are very active in that conversation about in-person learning, that recognize that we have revised quarantine guidelines for students who are masked, and masking in schools is a very important part of keeping kids in the classroom, and that's part of the reason why the American Academy of Pediatrics came out with their recommendation for masking in schools of students and staff regardless of their vaccination status. Yeah, the mandate, the question is clarification on the mask mandate. It applies to all indoor settings. There are certainly exceptions for activities like eating and drinking, and you can't wear a mask when you're eating and drinking. We understand that, so those guidelines will continue. Yes? Well, you know, just like everything we do, we try and balance, balance the benefit and the risk of our public health orders. So the question is why carve out differences for eating and drinking for restaurants and bars? And restaurants and bars have done a lot to accommodate everyone in this pandemic. They've been great partners with us in helping come up with these guidelines. Folks are distanced in restaurants and bars for the most part, and they're in small groups. So as long as the case rate stays where it is, we're going to work hard to avoid any other restrictions. And we believe that instituting this mask mandate keeps us on track as much as possible of avoiding any other restrictions in our community. Yeah. You know, this is the question is, how do you deal with the mask mandate and the confrontations around it? I would just recognize that this is a very difficult time in the history of our country and the history of our community, and we have to work through this together. And there will certainly be some disagreements. There will certainly be some confrontations. That's the country we live in. We have political discussions. Unfortunately, sometimes some elected officials and candidates for office will use this as an opportunity to campaign. But what we'll see in our community, I believe, is what we saw before, is most people just want to know what the right thing to do is to keep themselves and their loved ones, the patrons in their businesses safe, and they'll do that. And I believe that the confrontations around this will be minimal, and we'll move forward as a community to get through this pandemic, to get people vaccinated, and to get on to the other challenges that we had pre-pandemic and that will continue.
Well, you know, the CDC has to issue guidance for the entire country, and so often their recommendations are a general set of rules to follow. From a disease perspective, it really depends a lot on what the case rates are in your local region about what you have to do. So for St. Louis, I don't see anything that they could say that would change us from the course that we're on right now. We simply have contagion rates that are unacceptably high. And unless we do something to put a barrier between the infected and the uninfected, we're going to see that rate escalate further. So far, almost any mask works a lot better than no mask. There have been studies that show that some of the thin masks that are like t-shirt material, single thickness, aren't as protective. But I think the evidence is mounting that even homemade masks will suffice in a pinch. Certainly the sort of medical grade masks have tighter characteristics than others, but really the most important thing is wear a mask, cloth or paper or otherwise. You know, variants become dominant because they're more transmissible than the previous version. And we've seen it in 3 stair steps. The original Wuhan virus was replaced by the virus that ravaged Italy. Then we saw the UK virus, now known as the Alpha variant, and now Delta. Future variants to take hold will have to have that same characteristic. So it's likely that we will see new variants coming down that are yet again a little bit more transmissible than Delta. We don't know how far it can go down that pathway, so we'll just have to keep responding to what we see in front of us. Thankfully, what we've seen so far is that the vaccines are protective against the most serious consequences of all the variants, and with fingers crossed, that'll continue to be the case. I'm sorry, I didn't quite get that. Can somebody help me? My hearing didn't get that.
I didn't understand. Could you say that one more time?
Ah, great. So there are a lot of questions about, you know, how many people need to get vaccinated, when will we be out of the state we're in. The truth is no one knows. These are all projections. And the way you tell is when the disease starts to contract in the community. Then you know you've gotten to a point that you're making an impact. My guess is that we're going to need to push 80% or more in terms of immunity to the disease to see it in check. That could come from vaccination or from disease. But again, the duration of that's variable. From my perspective, it doesn't change what we need to do. When we see the thing expanding, we need personal protective measures. When you see it contracting, we can back off.
Thank you all for coming out today. If you did not get a copy of the whole floor, I do have a couple extras. There, you gotta go.
Thank you. Good morning, everyone. I'm Tim Fitch with the St. Louis County Council. Thank you for staying. I do not have a canned speech like you heard from the mayor and from the county executive, so I'm going to just talk with you and hear your questions. I had 30 years of sirens and gunshots, so if you pull your mask down when you have a question, I'd be happy to answer it for you. So the conversation that we're having on the county council is not about whether you should wear this or not.